We wanted to talk about schizophrenia and bipolar disorder. That's what we.
I think the reason is it's quite easy when we're doing podcasts like this to talk about what affects everyone.
Yeah.
And anxiety is something that touches everybody's life pretty much, during the course of their life. And there's a bit of a mystery around schizophrenia and bipolar. It's often represented in films, and usually not in the best way.
Yeah.
It's sort of dramatized to a way that makes it quite a scary illness. And then
I started reading about it because I'm schizophrenia. I'm going, oh, schizophrenia. Started reading about it, going. Everything I know is from media of some sort, mostly entertainment media. And as I'm reading, I'm going, it's all wrong. It's thinking, this is not what it is.
Yeah.
But that term is thrown out so easily and associated. You'll hear people sitting around, and it's terrible. But they're sitting around and going, "Oh, you're schizo."
Yeah.
And the way it's being used is not what schizophrenia is, and actually it's probably rather insulting to someone who is suffering from schizophrenia.
Absolutely. I think those pejorative terms like schizo and psycho are very much used on a daily basis, aren't they, sadly? And absolutely, I think it really stigmatizes people that do actually have schizophrenia and fuels this fantasy about what schizophrenia is.
I mean, it got me thinking, and you can jump back in for a second, Jenna, but it got me thinking, the way that those terms are thrown about, I could be sitting downstairs in the lobby here at ROVE, talking with someone, and just, you're a little schizo today. And that person might actually be suffering from schizophrenia.
Yeah.
They might be diagnosed and working through things to manage this, and it's just, wow, man.
Yeah.
I mean, it really, as I started reading about this, I realized you really have to be more cognizant of what this is, and just really a little bit more cautious on using terminology that is just not fit to be used
Yes.
in common daily parlance.
because what you're alluding to is the fact that somebody living a very normal life might be suffering from schizophrenia.
Yeah.
And I think a lot of people have this connotation that if you have schizophrenia or severe bipolar, that you are someone that's a murderer. Because of the famous film Psycho.
Yes.
Just think
Yes.
of that.
Yeah.
And it doesn't mean that these people, there is a link with very, very severe untreated aspects of schizophrenia. There can be the time that they might hurt somebody, but how much of the rest of the population do you also get people that hurt others? It's not as a schizophrenia murderer. That's a wrong link to make, but that's what a lot of people will think of firsthand.
So what is schizophrenia?
Schizophrenia is, well, what is schizophrenia? Primarily, schizophrenia is a delusional disorder. So when you meet somebody who has schizophrenia, they will have developed some very unusual thoughts and beliefs that they believe to be 100% real. And over time,
When you say thoughts and beliefs,
so for example, somebody might become incredibly suspicious. They might think, for example, a classic one is thinking that you're being followed, thinking that your phone is being tapped by something like the FBI or the CIA, or whichever country you live in will have their own specific intelligence services. And often people with schizophrenia will develop this idea that their phone is being tapped. They will have ideas of reference, so maybe they're watching television and something comes on the television. They'll believe that the whole show or the newscast or something like that is directed at them, or that there's a special message within the television program, or a particular TV character is conveying special messages to them. So that's what I mean about it being a delusional disorder. Sometimes people will develop a belief that maybe they're John the Baptist, for example.
Okay.
Yeah.
So they take on a personality. They take on a personality that they might believe, I'm John the Baptist, I'm Joan of Arc,
I'm Joan of Arc, I'm Michael Jackson, or I'm something, or I'm married to a very famous person. And
you're describing television shows. I've watched all of these characters on shows.
Yeah, so that's what I mean about the delusion, and it's fixed, and so they 100% believe it. So when you talk to somebody who is in the midst of a psychotic episode, they will 100% believe that what they're thinking and what they're seeing is the truth. Yeah. It's like it's very difficult to get them to consider an alternative perspective.
You mentioned the word episode.
Yeah.
And that they're in this episode. So if I'm believing these things, if I'm having an episode, how long do these kind of things last? Are they indefinite, or do they tend to have is it sort of like an ebb and flow format?
So yeah, people have episodes of schizophrenia, and the length, the duration of these some kind of psychotic episode can vary. Sometimes you might be in that for a few weeks or a couple of months, and in more acute cases I've worked with people where they've really been lost in that delusion for a year or more. Wow. Where they're really fixed on these ideas. So it can vary, and the important thing to say, it is episodic, so you will have periods of recovery in between the episodes of being floridly psychotic.
So does that person, when they're in an episode and then when they come out of that episode, do they realize that they were in that episode and that, my thinking was, why would I think that? Are they able to compartmentalize and sort of look at themselves, or not usually?
It depends on the severity of your illness and also other individual factors like your ability to have insight. I have to say, it's actually really painful to sit with somebody as they gradually begin to think the delusion that they've been lost in or caught up in might not be true. And you can imagine, it's like now you've got a clear idea of who you are and what your reality is, your wife, your kids. Now imagine if that suddenly was all being taken away from them. So no, actually that's a delusion. That's not you. None of that is real. It's it can be a very distressing time for people.
But it can also work the other way as well, because with schizophrenia, you very commonly can get paranoid schizophrenia or schizophrenia with paranoia.
There's different types of schizophrenia, different levels of schizophrenia.
Well, this tends to be quite common, and it can be so frightening, and it's so frightening for them, because imagine if you think people are trying to get you, and they often will try to self-medicate with alcohol or drugs, and that's why they have huge rates of sort of substance abuse, and it's because they're just trying to run away and they're frightened, and that can be very hard to watch as well, because I can't even imagine what it is like to have to live through that. Likewise, I have seen a few patients that have lost family members, and they have then gone on to develop hallucinations where the family member is with them saying, please kill yourself and come and join me. And the torment of what should they do, and they have to be taken away multiple times to stop themselves from hurting themselves, ultimately trying to reach the family member. And it's an hallucination, it's not real, but to them it is very, very real. So it depends, I suppose, what delusion it is that they're having at that time.
Yeah, the delusions can vary, and definitely delusions that people are trying to kill you is very prevalent, so you can imagine the amount of fear that goes with that. Or the other thing to say is people with schizophrenia have usually different kinds of hallucinations. They have auditory hallucinations, which is I think what you're referring to, isn't it? Is that they'll have the voice of somebody in their head. And they're often what we call command hallucinations. Often the voice is instructing that person to do something negative, like harm yourself, cut yourself, jump off the bridge. Don't believe your mom, she's the devil. They've got those sorts of things, hallucinations, those sorts of auditory hallucinations that are instructing them to do things.
The numbers of people globally who've been diagnosed with schizophrenia, over 20 million worldwide, according to the World Health Organization. As Jenna said, they can find ways to self-medicate, treat themselves. If they're not seeking help, they tend to pass away. They tend, according to the World Health Organization, 2 to 3 times more likely to die earlier than the general population. So what do we do? Like, how do we, I'm listening to this, it's just hearing you talk about it makes me feel sad in a sense, to think that this has happened to someone. So my first question is, okay, so how does schizophrenia even come about? And then what do we do, or how does someone get treated for this? And do people necessarily want to be treated? I would think they do, but if you're having an episode, maybe you're happy with the way the episode is. I mean, I don't know. So how does schizophrenia happen?
Yeah. Shall I say, or do you want to say?
I know I'll start and then
Yeah,
Cheryl.
yeah.
Just
Cheryl's the
pick up on each
expert.
other.
So you're the medical doctor, so
Yeah.
I'm happy to say, but perhaps you can say.
Cheryl is the expert when it comes to anything like this, so let's remember I'm not a psychiatrist. But usually, so first of all, how do you get schizophrenia? There is a family link, but a family member having schizophrenia doesn't mean that you're going to get it. And likewise, if you don't have a family member with schizophrenia, you may still get it. There's a lot of research that's going into what happens sort of at the infancy stage. So when you're a baby or just before you were born, were you starved of oxygen at any time? Did you have a nasty viral illness? So there is a lot of thoughts around the newborn phases. Did something happen then that potentially affected the brain somehow that could go on to lead schizophrenia? It's also, there's a lot of encouragement, as we say, that absolutely everything about a healthy diet as they're growing up, if they've been like having exercise and a normal upbringing. So it's kind of a little bit question mark, but there's a few, it's kind of multifactorial basically. And then the way that it can be quite hard to spot. People will often have a feeling that there's something not quite right with their child, but they don't know what it is. And they find that they start to become socially withdrawn, or they say odd things, or they might have illusions of grandeur and they speak about themselves in quite an inflated fashion that just doesn't quite feel right. And maybe they start to dress quite dark, or they might lose, because often these people have negative symptoms, which basically means they can lack a facial expression, they can speak quite monotone or quite flat, almost like you would see with someone with quite severe depression. And they might notice changes like this, and that's usually how they might go to seek help. And that's why I would encourage other people as well, if you see things like this, to go and seek help. But I'm sure Cheryl's got a whole barrage of extra
I think that's
info.
That's right. I suppose the general thing that we think with schizophrenia is that we're not 100% certain what causes it. It's a combination of, like Jen is saying, genetic factors. So there's an increased risk if you have a parent, for example, that has schizophrenia, that increases your chance of also having schizophrenia. But that doesn't automatically mean it's not inherent. It doesn't mean you'll automatically get it.
It's not hereditary.
It's not hereditary, or there's not direct heritability, but there is an increased risk factor. And then there's your environment where you grow up, where the interactions you have in school, the dynamics in your family. There's quite a bit of research that shows children that grow up in really highly volatile home environments where there's lots of fighting and arguments can be a trigger. And I guess the number one factor is stress. And so we could all, different people could be born with the vulnerability for developing schizophrenia, but if their life is relatively okay, then they probably won't get it. But for some people, if you have that vulnerability and there are enough stress factors in your life, that seems to be one of the main triggers for developing your first psychotic episode.
Okay.
Yeah, so a lot to do with stress.
So it almost sounds like it's almost like a chemical imbalance or
Yes.
something going on that then triggers through your complete environmental ecosystem.
Yeah, and that's a really important point to say, is that there is an organic element to schizophrenia. Something really is happening organically in the brain. It's not just a psychological disorder. Something organic is happening.
You know what's interesting though is that in countries such as India, in parts of India, it's been found that people manage their schizophrenia a lot better because of the whole family unit. Whereas here, say in the UAE as expats, we have a much smaller family unit. Somewhere where they are surrounded by families, they either have lower rates or they actually just manage schizophrenia better and they're a lot more stable. I don't know whether that's something I'm sure it is that you've heard, but I thought that was quite fascinating.
Well, and this is when I fall into the... There is quite a lot of research, actually, even in the UAE, because I've worked in a psychiatric hospital here. People seem to have less severe episodes of schizophrenia, and I think that is a lot to do with the society, the level of family support, access to medical teams that are not too prescriptive, like they're quite open-minded. So that removes some of the stigma around having schizophrenia, because people don't invest too much in the diagnostic label.
Which is, I'm thinking that has got to be, depending on the society you're from,
Yeah.
schizophrenia, and in other societies, when say schizophrenia, okay, we got to deal with this. And the family sort of circles the wagon and, okay, we're going to deal with this.
We're going to deal with it, and we're not going to get so hooked upon the label, and it's about what can we do to support that person. Yeah. And so I think there's quite a lot of research, as Jenna said, in places like India and the Middle East, that sometimes people with schizophrenia, the care system somehow reduces the severity of the distress they're experiencing when they're psychotic.
I feel like there's a book, but go on. So there's definitely a book coming.
No, the book. No,
Can you feel it?
I think for me, because I do feel really strongly about schizophrenia because it's so misunderstood, is one of the remarkable things that's happened in modern day science is we now have antipsychotic medications, and people with schizophrenia absolutely need to take antipsychotic medications. One, because it helps alleviate the distressing symptoms they're having, but also if we have untreated schizophrenia, it causes long-term organic brain damage. So you're reducing the functionality of the brain if you leave schizophrenia untreated, and that's why we take it really seriously, trying to intervene as quickly as possible and trying to ensure that people are compliant with their medication.
Also for the short term as well, because what Cheryl said is that it can affect the brain long term, but in the short term, as I've said, sometimes people have been told or given command to do terrible things to themselves or even to other people, and that's in very severe cases, but you want to avoid that happening anyway.
Yeah.
And it would also try and reduce the substance misuse that can occur too.
I'm listening to this, and the big question that keeps rattling around in my brain is we're talking a little bit about medication. Antipsychotic medication becomes really important. Having an infrastructure, getting counseling, etc. All of these things become. Where does the sort of the buck stop in that someone is the ball is put in motion to start treating them for schizophrenia, or even the suggestion that I think you might have schizophrenia. You need to get this. You need to get diagnosed. When is that the gray area where we run into problems, that there are so many people walking around or in situations where they don't know this is going on and they don't know that this can be treated? They're falling through the cracks. And that leads to so many problems. Like, when does that start? Like, how does that start?
Yeah. Well, should I say, or do you want to say?
Yeah. Well, carry on.
I think with schizophrenia, it's considered an acute psychiatric illness, and
no one wants to hear that word. As soon as you say psychiatric illness,
but
people kind of like.
I know, but it really is. But
Yeah.
it's not that there's anything wrong with having schizophrenia. It's, as we were saying earlier, it's the stigma attached to it. If we could just be much more open-minded about what it really is. It is an illness and it can be treated. It's a very, very serious illness. And when people are floridly psychotic, sometimes we have to forcibly detain people in a psychiatric unit, so their rights to live freely in society are temporarily removed, and we would enforce treatment. And that's very unusual that for other mental health conditions, but people who are floridly psychotic are a risk to themselves and possibly a risk to other people, and they absolutely have no insight. You can't say, look, I think you need to come in for a couple of days and take your medication, because when people are floridly psychotic, they're not able to have that level of understanding or awareness. So that's another symptom, is complete lack of insight. Yeah.
As Cheryl said, that's a really acute stage
Yes.
where everything has got. You talked about the episodic nature of it, and that's.
Is that just a small group of people that can get to that point? I mean, you live in this environment.
So if you have schizophrenia, there will always be a point. 9 times out of 10, it will be so severe that it will require a period of hospitalisation. Now, what you see when people are really well managed and they've got a good team around them, they may still have a relapse, which means that we might admit them to hospital for shorter periods of time, because we can move quickly, we can admit them quickly, and you can increase or modify the medications and put other protocols in place which reduces the length of time someone will be in hospital. But certainly something we do a lot in the UK is we try to treat people in the community, because going into hospital is really stressful. So a lot of the work that you're doing is trying to prevent a hospital admission, and as much as possible helping people lead meaningful lives in the community.
So I mean, this all makes sense to me. The question that it's just rattled around my brain is, if we can catch this early, and I mean, if someone is going to manifest schizophrenia, it probably doesn't just happen when they're in their 30s. It's probably been a slow burn from when they've been young, etc. Do you think we're missing it in our younger children because we don't know what to look for? They're just kids. I mean, not saying, they're just kids. They're doing things. Do you think that's part of the challenge that we face? Is just recognizing it and having our teachers and parents who don't want to admit that there could be an issue, just to sort of flag and say, hey, this is something you talk to a pediatrician, this is something you talk to a counselor, this is something I need to, maybe it's nothing, but maybe it's something.
I think what you just said hits the nail on the head. Is often people don't want to admit it, especially if it's their child. And sometimes you just think maybe they're just a bit of an odd character and it's written off, and so they don't necessarily present for help, because it could be something or it could be nothing. But I think if you have a gut instinct as a parent or as a teacher or somebody that works in the educational system, there's something just not quite right, and as I say, they're becoming quite socially withdrawn. There's no harm in going to have a conversation with your general practitioner, and then they can do an assessment and then look at potential referral or not. And it's such, as Cheryl said, it's a very severe psychiatric disorder. No parent wants to hear that. And I think that there's a huge fear. There's also still a stigma attached around it. And people are afraid, actually, of sort of coming to terms and admitting that there is a problem. On the other foot, I do think these days we love giving, we talked about not diagnosing and not giving labels. These days we love to diagnose things. And we probably find that people are going to the doctors a lot quicker than they used to. And maybe that is why, as sort of Cheryl said before, in certain countries we're not giving a diagnosis of schizophrenia when it does actually exist there. But maybe we look at rates and potentially they're increasing. Are they increasing, or are we just diagnosing quicker? I know, for instance, if there was something peculiar with my boys, I'd be very quick to want to go and take them, and sort of my always thought was try and nip it in the bud and try and get it early. Because if you can get these people on appropriate treatment, you can get them seeing the right people, providing the right environment for them. There's no reason why they can't, in the large, have a relatively normal life. I've sat down with lots of patients that have schizophrenia, and you wouldn't know that there was anything going on, especially when they are in between psychotic episodes.
Absolutely. Just to say that you can have schizophrenia in childhood, but it's actually really quite rare. Yeah, so that's important for parents to bear in mind, but obviously it does happen. But normally schizophrenia will start to show itself maybe in later adolescence.
I have early 20s in my mind.
Yeah, late adolescence to early 20s, the person might have their first breakdown, but it can be very, very difficult to know if somebody has schizophrenia, because there's a phase, which I won't get too technical, it's called it's a prodromal. And during that phase, as Jen is saying, the young person might start to display some unusual behaviours. Maybe they become very obsessive, maybe they suddenly withdraw from their friends, maybe they stop washing, they seem quite depressed. But on the other hand, they're still functioning, they're still going to school, they're still doing their work. And actually that's the beginning of the illness. And actually we do in the UK a lot of work to try and identify people in that prodromal area with the prodromal phase, because you can really proactively intervene, and that can really help to change the course of the illness. If you can identify it early, and that you can try to start medications and other treatments, that can really, really help and make a difference.
It's hard, isn't it? Because you're not saying they're doing X, Y, Z. It's not, it's not as clear it is a clear diagnosis for somebody within Cheryl's field, but for the Joe public, it's not like the very wishy-washy type symptoms, aren't they? It's not as clear cut, which is why it's good to educate people about it so that they're alert to it, and they might sort of look at the myriad symptoms that are coming together, and then want to take them to see the right
The
professional.
extremes are pretty easy to understand, but it's the very mild.
It's the milder changes, and then sometimes the young person will also get a bit better, and they start to go back to their friends, and they start to take an interest in sport again. And then, so what was going on there? Was that really just a phase? Were they really ill? But then something else will happen. So
School tends to be one of those things. I'm thinking 20s, heading off to college, heading off to university. Okay, we're not doing that right now because of what we're in some cases, but perfect opportunity for all of these, perfect storm to happen, and for this to become an issue. And that again brings me back to when we're at school, parents are away, you're living with maybe roommates, you're living on campus, you're more detached, whereas at least when you're in high school and middle school and grade school, you've got a teacher on you or a group of teachers that are on you. Through high school they get less and less, but at least they're seeing you and watching things change. In university, you're like a log floating downstream. You're lucky if you bump into somebody.
Exactly, and actually universities, especially the first 2 years of university, is when you're more likely to see somebody having their first full psychotic episode. So it's about that age group, and it's also about, I think, that stress of moving away from home and not having family support, and all of the things around you that maybe helps to mask some of the symptoms. Because you've got your mum at home probably making sure you get out of bed, and they drive you to school.
And they're okay, what's going on? And they want to say, okay, what's going on? Sit down and talk to me, tell them what's going on.
And they're going to feed you and all of those things. But when you go to university, you don't, as you said, you don't have all of those structures in place. And that's often when someone will have their first episode. Yes.
It's a lot more common than you think as well. That's something to note.
Yes.
I think you think it's such a minority, and it's not really. I think figures are something like 1 in 100 people that can have
That's a lot.
a psychotic episode. That's a psychotic episode in their life.
Yeah.
So
But that's still a lot.
it's a lot more than you think.
Yeah.
I think you probably know the statistics better than I do.
Yeah, I don't know if I can quote the statistics, but there's a difference between having a psychotic episode and having schizophrenia. So anybody can have a psychotic episode.
Even depression, you can call it a psychotic
Yeah, so
episode.
that's it. So any one of us could have a brief psychotic episode. So you sometimes see that in the population, but schizophrenia is a different illness to having a brief psychotic episode.
But actually,
That's a whole other term.
Yes,
You guys just throw it
yeah,
around.
it gets a bit complicated.
Well,
yeah.
but when you think of it, someone says, "Oh, you're having a psychotic episode," and that just encompasses everything.
I'm trying to see if I can find the statistics. I'm sure it's actually 1 in 100 that has schizophrenia, which I thought was particularly high. I didn't think it was that high.
I didn't think it was that high.
I'm trying to see we might have to on the next podcast give the tagline, but I think it was actually 1 in 100. But I thought that seemed a little high. But it is that what we're saying is it's more common than you think.
And when we talk about being more common than we think, especially in mild schizophrenia, do people realize that they have schizophrenia or that there's an issue that they're? I mean, I just wonder, because of the way schizophrenia seems to manifest itself and develop, if it's very possible. And as you said, you said much earlier, it's actually a little sad when you're having a session with someone and they start to realize that they were going through an episode of schizophrenia.
Yes. It's like waking up from a bad dream.
Yeah.
Oh, yeah.
And I guess thinking about all the people that you would have interacted with and spoke to, and maybe not physically hurt, but just mentally feel like you've let them down, and the embarrassment and stuff must just be brutal to deal with.
There's huge shame and embarrassment for lots of people when they come out of it, and also that sadly makes them a little bit, that increases the risk of maybe attempting suicide, because your whole sense of everything is collapsing, and it's, maybe acted in ways that you would never dream of acting. And when people hear what they've said or what they've intimated they might do to people, they can be so consumed with feelings of embarrassment, shame and guilt. They just, they can't reconcile what they were doing when they were psychotic and what they were saying with the person that they know themselves to be and the values and beliefs that they otherwise to have. We'd never normally think of hurting anybody,
Right.
or swearing, or
Yeah.
blaspheming, or any of those things. Yeah.
When someone's diagnosed with schizophrenia, is this a lifelong diagnosis? This is something that now, when you're diagnosed, you need to work, or you work at it with counseling, with medications, or does it disappear?
You don't recover from schizophrenia. So once you have schizophrenia, it's a lifelong illness. But as Jenna is saying, is you will meet people living full lives, they'll be working, they will have children, they will be enjoying aspects of their life, and also beyond, living with schizophrenia. But there's a whole range of spectrum
Right.
of where you might fall with schizophrenia.
I'm thinking of a show that I watched, American show Shameless, which
Yeah.
there was a British, it started in the UK,
Yeah.
I think it went 1 season or something. The American version has gone 11 seasons. And one of the main characters has schizophrenia.
Okay.
And as you're talking about this, this character is medicated, and he's gone for counseling and things. And I remember a very specific part where he has he's got a job, he works, he's part of society. And I remember he's an EMT in one of the seasons. And the people at his place of work, I've obviously been briefed, and he's briefed them. He said, look, and it was interesting because he recorded a video that they kept on their phones for if he ever went into a schizophrenic episode, that they were to play for him. And they knew the people, the family members to call if this happened. And I just remember that because obviously it did happen, where he had a problem. And the rallying of everyone, and the first thing are you off your meds? What's going on? And this sort of, we need to get you checked in for some help. We need to get you balanced again. We need to get, but he was irrational. Like he really believed, not irrational, but he really believed, as you've been describing, that this was going on and this was happening. And it was really sad, but it was also really warming to see all of these people working to help him. Yeah, the support system. And made me think the support from the medical community right through to everyone knowing that, I've got schizophrenia.
Isn't that what we should be doing?
Yeah.
Not fearing these people,
Yes.
but supporting them.
Yeah.
Because what we've said, we mentioned just a second ago about psychotic episodes, it's very common that people not that everybody will get a psychotic episode, but it's very common in life.
Well,
that people get-
Cheryl's told us psychotic episodes are a very general term. We got to be careful with using that
No,
term.
this is what I'm saying. It is a general term. And for instance, a lot of people that have a severe infection, people can say, oh, they're psychotic, they're not. That's a delirium. It's a very different thing.
Yeah.
But you can get from a whole different things. You can get whether it's severe stress, depression, whatever, you get a psychotic episode. That is a huge stressful thing. That is something that somebody will think about for the rest of their life. They might tell somebody about it. And what we're saying with people with schizophrenia, they are subject to that for the course of their life at different times. And so this is, how awful for somebody to have to carry that.
Yeah.
So that's exactly why we should be supporting them. So when somebody, Joe Public, has had a psychotic episode, and that is like a real sort of low point in their life, schizophrenic patients, people with schizophrenia, have got to cope with that for the rest of their life. So I think if we took away a few things from today, it's don't fear it, it's about supporting, to make sure they get on the right treatment as early as possible, as soon as it's found. And if you do, or you are concerned about yourself, or somebody's concerned about you, just go and get checked out and have a conversation with someone. It doesn't take long, it just takes a quick appointment, that's all.
Is stress a big play? I know we're going to wrap here, but is stress, the one word that I keep hearing, as I'm thinking back to everything we've just said, the word stress keeps coming up. And we use it different stressors, but is stress a key in all of this when you're meeting folks and you're counseling? Is one of the underlying commonalities stress in their life?
Yeah, what you normally find is prior to a psychotic episode, someone will have been through something really stressful. So you might meet someone who's been really stable with schizophrenia for a number of years. As I said, they're functioning quite well. But then, for example, something might happen, like they lose a job, or they might have a bereavement, and something around that is so stressful for them it can activate a schizophrenic episode. So stress plays a really important role in the number of psychotic episodes somebody might have.
I get the feeling we just need to talk more about schizophrenia. And
Yes.
families at school with, with our loved ones, just, if 1 in 100, if that stat stands.
I've got to find,
You're
I've
gonna
got
find
to,
it.
I've got to prove this that I
Yeah.
saw.
But even if not, when I'm just looking at the numbers from the World Health Organization, 20 million people around the world, and that's who are, and I don't know which level of schizophrenia they're coming in at, but this just seems to me like this is more common than we than we typically might think, and it's something that we need to keep an eye out for.
Yeah, and just to what Jenna was saying, I just want to say a few key points about it. Is family members can be stressful. Please don't encourage them to stop taking their medication. This is something I see so often. Just allow the person to stay on the medication. If you have schizophrenia, please stay on your medication. In society, we need to make sure these people are not so lonely and isolated. They're just ordinary human beings that have an illness and they need some support. And wouldn't it be amazing if people that had quite severe mental health problems could be coming somewhere like this? Like, we need to have amazing centres for rehabilitation and ongoing support for those people, that they've got somewhere they can go, because there are so many other things beyond medication that people with schizophrenia really benefit from. They do well with art, they do well in groups, they do
Podcast.
podcasts. Honestly, they really can do amazing things, and that's all part of their treatment. So it's not just popping a pill and talking to somebody. They really need amazing centres where they can be helped to learn to live with their mental health problem, and that will stimulate their brain and help with their confidence and help them make friends and be useful.
So I'm looking at 1% of the population is going to be diagnosed with schizophrenia.
Really?
So that's still, what do you think that's still?
Yeah.
It's a lot.
Ladies, thank you very much. This has been a really fun conversation.